Nursing.
Come in.
Hi. Good afternoon, good evening at this point. My name's Shakira. I'm going to be your nurse for today. I'm going to be doing a complete head-to-toe assessment on you, and it's just to check your status since you just got admitted to see, what some of your vitals and how everything is working right now, just to give us an idea. Did you have any questions about anything before I get started?
No.
Nope. Okay. Well, can I see your ID band? And let me see your name, name and date of birth.
11/16/97.
Okay. And William, why are you here today?
Full body exam.
Okay. And what's today's date?
11/23/21.
Okay. You know where we are, the hospital?
Yeah.
Okay. Where are we at?
The hospital.
Okay, sounds good. So it seems like you're awake and alert. I'll ask about, are you experiencing any pain right now? On a scale from 0 to 10, 0 no pain, 10 extreme pain. Any pain?
No pain.
No pain? Okay. Well, I'll go ahead and get this assessment started. Before we get started, did you need to use the restroom or anything? Or was there any concerns that you wanted me to highlight for today?
Nope.
Okay, sounds good. All right, well, I'm going to start off. I just did some hand sanitizer. I'm going to put some gloves on, get this started. Okay, and like I said, throughout this whole process, I'll be kind of letting you know what it is I'm assessing, why I'm assessing it, and giving you feedback so that you're aware as well of what's going on, okay? So I'll be assessing your skin throughout the entire process. Right now, it's looking pretty good, looking normal skin. I'm just going to assess your face right now. It looks symmetrical on both sides, okay? And the skin, it's appropriate here, especially for in your face. You got some beautiful skin. That's really nice. So I'm going to start off with your head. So I'm going to just touch on your scalp. I do know you don't have any hair, but okay, your head, the shape is looking good. I see that you don't have a beard, you have a little mustache, so I am gonna just do that there. Okay, so your head, it looks symmetrical. Next,
Maybe check my jaw.
Next, right now, what I would normally do is assess your vitals, but I'm going to bypass that right now and move on to... Okay, hold on a second.
We're not starting this off.
Okay, I can edit this out, right? Can I edit this part out?
I think so.
What?
Actually, I'm not going to put on my gloves because I don't need any gloves. Okay, because I didn't do the full... Okay, looks good with your head. So what I am going to ask for you to do is to, with your face, can you scoot your body a little bit towards me, like a little more?
What do you mean?
Face directly towards me so that you
Oh,
see how
I'm
you're
sorry.
in front of me. Thanks. You can even go over here. I just need the camera to see. Okay, so I'm going to ask you to, for your face, I'm going to be feeling down, felt your head, feeling your... Oh, you're
It's cold.
I'm sorry if my hands are a little cold. Okay, damn it, I just want to before I do this shit. This one. My hands may be a little cold. Feeling your head, I don't know how. Can I edit videos together? Okay, I'm feeling your head. I'm gonna let y'all. Put your. Okay, bro. We don't have to do this. Okay, I'm gonna be assessing your head. Looks good. Looks symmetrical. Exactly. It's not. You smiling? Okay, that's actually what I was gonna ask you to do next. See, I see you doing a smile. I'm gonna test. Can you do a frown? Can you puff out your cheeks? Show your teeth. Okay. So it's looking like you're able to assess everything on your. I don't know what the hell I'm doing. That's why I haven't done this shit yet. Oh yeah. Okay, so here's your temporal arteries. And then I'm gonna do your temporomandibular joint. Okay. That is good. So next I'm gonna be assessing your eyes. So I'm just looking at the external exterior of your eye, and it does look symmetrical. I'm gonna pull down your eyelids right here to check your sclera. Okay, nice and pink in there. Okay. I'm gonna test to see your pupils to see if they'll dilate. So what I'm gonna do is I'm gonna dim the lights in here. And I'm gonna shine the pen light into your eyes one at a time to just look. So just be prepared. I'll go on one side first. Let me see. Okay. And your eyes, their pupil did dilate to about a. Okay. And your pupil dilated there. I honestly didn't see it. So I'll turn the lights back up. I'm gonna check for accommodation. So just look straight ahead, and I'm gonna touch it like right here in the middle. Just keep looking straight ahead. I'll do it one more time. Look at the pen light, follow it, and keep following it while I go straight ahead. Okay, and your eyes did cross on that. Next, I'll be checking to see if you can follow. So I'm gonna keep the pen light here and just move your eyes and keep your head straight.
What is that supposed to be? A snowflake?
Okay, good. All right, you were able to get to all 6 cardinal directions. Okay, so now that I'm done assessing your eyes, they did have perla, so means that they're perla. And now I'll assess your nose. So first, I'm just gonna check out the anterior extent of your nose. It looks symmetrical and it is midline to your face. Next, I'm gonna use my pen light and just look kind of up in your nose. So if you'll just tilt your head up a little bit for me to see in it. Okay, it's looking clear in there. Clear, okay. And then now I'm gonna test your sense of smell. And so I close your eyes. I'm gonna shine something in front of you and see if you can smell it. Just take a whiff. Did you smell what that is?
Yes.
What is it?
It's some type of seasoning, cinnamon.
It is cinnamon. Okay, you can open your eyes now. That's good, yeah. So now I'm gonna check your nasal airway. So if you just close one side of your nose and breathe in through your nose. Okay. Now if you'll close the other side of your nose to breathe in. Okay, good. Now I'm gonna access your ears. So I'm gonna inspect them, and they look appropriate. This side, inspect here. Definitely does look appropriate. I'm gonna just lightly palpate, lightly touch it. Move here.
I'm sorry.
Test this article. Okay. And then I'll do the other side. It's tickling you, right?
Yeah.
Right, I have to do this.
Okay.
Okay. Try to relax. Yeah, I know, okay. I only have 30 minutes.
Come on.
William, I have 30 minutes.
Stop
it!
I'm sorry.
Stop doing it. You're acting like a fucking idiot.
Come on, just pretend to do it.
I can't pretend.
Come on.
Okay, then I'm gonna palpate this article right there. Okay. Now I'm gonna just perform a whisper test. And so what it is I'll say a word over here and you'll just tell me what it is. I'll occlude or close this side of your ear. What did I say?
Apple pudding.
Okay, I'll now check on this side.
Mashed potatoes.
Okay, good. So it seems like your ears are all intact. You can hear out each side. I'm not feeling any tenderness. Have you been experiencing anything?
Just a little ticklish.
Okay, which is definitely understandable. I definitely understand that. Okay, so then next I'm going to assess your mouth. And for that, I'm going to put gloves on.
Can I get some water? Can I get some water?
Put these gloves on. Okay. Alright, and I'm going to inspect your mouth. I'm looking at your lips. The color looks good. It's symmetrical. We did do that test earlier. If you want to open your mouth wide, and I see your tongue, okay? I'm actually going to test the strength of your tongue, so if you'll move it from side to side. I am noticing some whiteness on your tongue. Usually it should be pink and moist, so just note that. Okay. Next, I'm going to use this spoon to get a deeper look into your mouth, into the vulva and stuff. And I'll just have my pen light so I can see. You'll just open your mouth up wide. Open it up wide. I didn't say take your tongue out. Open your mouth up wide. Like this. Okay. Okay. Yeah, I can see all of that in there, in the vulva. Oh my God, is the light coming out? Okay. And now lift your tongue up. And I'll just look under there. Okay, it looks pretty clear. I don't note any cavities in there. All right, now put your tongue down. Now, okay. So I'm gonna check your range of motion for your neck. So I'll just inspect it. If you can just lift your neck up. Okay, and it does look symmetrical. I do see this trachea here. I'm gonna touch it. Just gonna feel. Okay. And then if I can have you can lower it, turn your head to the left. Now turn your head to the right. If you can go up and down. And I'll put my hands on your arms. You can lift your head back up and put your hands right here. And you push it up while I push down, okay? Squish it up. Okay. Alright, good. So it looks like you got some good range of motion going on. Next I'm gonna inspect your lymph nodes. So I'll be palpating, so I'll be touching your hands. I'll do it bilaterally. And I'll start here. Here's the pre-auricle, the posterior. Here's our occipital. Here is the supramandibular, sensitive right there.
Ticklish.
Submental. Okay. Then I'll go down. You kind of gotta relax so I can get the rest of the lymph nodes. All right. Here we go. I'll try and do it really fast. I can't have you laugh while I do it because I'm trying to assess it.
I'm sorry.
Here we go. And I'll go right here in this clavicle area. Alright, I've done that. Now I'm going to palpate your carotid artery. So I'll just get up here. I'll do it one at a time. Okay. It's about a 2+ on that. I'm going to auscultate the carotid artery. And I will be using the bell side. And here we go. Lift up. Okay, and I'll do this other side. Alright, and it seems like it has some bruits on the carotid artery. Okay. So next I'm going to start assessing your arms, and I'm going to be looking for your, is it okay if I'm touching you?
That's fine.
Are you laughing? Okay. I'll feel your arm, checking for the skin and cut color, appearance, if you want to help me or no. Okay. Check this brachial pulse. If you can just lift your arms like this. Why are you saying like that?
What am I doing?
About a +2. This radial pulse. About a +2. Okay, I'm gonna check your hands for your capillary refill. Check your other hand for capillary refill. If you put your, actually I'll just check right now. If you'll squeeze my hands, check your grip. Okay, that's good. Now if you put your arms like this, like this. Okay, and I'm gonna pull on you, and you just push the opposite. Pull. Okay, and then I'm gonna push, and you. All right, so it looks like you got some good range of motion. You had good capillary refill. With your hands, I'll ask you to hold your hands out right here too, and push like you're going gas pedal. Push down and up. Have them the same way, and push up like this.
Push up like how?
Can you put your arm straight like this, and pull back like that when I push? Okay. All right. So next I'm gonna be assessing your chest area. So if you would like to stand up, do you feel comfortable taking your shirt off?
Yes.
Okay.
Okay.
You want to stand up, and if you'll take off your shirt, or you don't, yeah. So
I'm kind of fat.
I'll assess your chest area, note the hair, and the skin color is looking normal. I got some Tuger going here, so you are hydrated.
Turger.
Yeah, so I do pinches sometimes to see if your skin will recall, and it did. it'll show if you're dehydrated or not. So here's your chest bilaterally. Next, I'm gonna go ahead. I see that you're breathing fine, not really using any accessory muscles to breathe. Next, I'll just go ahead and listen to your lung sounds. So,
Can I put my shirt back on?
well, you can. I have to do it. You can put your shirt back on. I have to touch this to your skin, so I'll just go under.
Okay. It's the wrong side.
So I'm gonna have to like go.
Okay. Now you can lift it up as you need be.
Okay. So I'm gonna listen actually to your heart sounds first. And I'm gonna start here at the second intercostal space and listen to the aortic. I'm gonna go straight across to the pulmonic valve. Then I'm gonna go down to the third intercostal for the tricuspid. Go down one more for Erb's point. Oh, sorry. Oh, sorry about that. I'm actually here. This is pulmonic, and this was Erb's point in the third intercostal space. And then this fourth one is going to be our tricuspid valve. And then I'll go right here underneath to listen to that aortic. Okay, and then I'll just go over it again real quick with the bell part. And here's this aortic again. I'm going over here. If you could just, or whenever you're done scratching. Pulmonic, the Erbs, tricuspid, and of course that mitral or apical pulse, which I would listen to for 1 minute. Okay, so your heartbeats are sounding good. S1 and S2 are present. No S3 and S4, no murmurs. So it's sounding good. Now I'm gonna auscultate or listen to your lungs and to check your breathing. So I'll have to use this again as well. So I'll have to be going in and out underneath to assess. Okay, so I'll start here. Every time I put my belt on here, if you'll, or my stethoscope diaphragm on it, if you'll just take a deep breath in, and I'll start here, kind of above the clavicular, and just take a deep breath in. Take a deep breath in and out. Over here, deep breath in and out. Okay. In and out, deep breath in.
Okay, take those right there. I'm sorry.
There's no. Deep breath in and out. Deep breath in and out. Okay, deep breath in and out. Okay, let me go up from under your shirt. Okay. Have a deep breath in. Out. Okay, deep breath in. Out. Deep breath in. Out. On this side. Deep breath in. Out. Deep breath in. Out. Okay. And your skin lifted pretty good too. Now if I can just assess your breathing sounds on your back. If you don't mind maybe standing up. Okay. And I'll start here at the top. Deep breath in. Deep breath in. Can you stand still while I'm doing this?
Excuse me.
I get it. Do you want to finish?
No, I was stretching. I'm sorry.
Deep breath in. Out. Deep breath in. Out. Deep breath in and out. Deep breath in and out. Okay.
Ooh.
Deep breath in and out. Deep breath in and out. Deep breath in and out. Do you always do this?
I'm sorry. That is sensitive skin.
Deep breath in and out. Deep breath in and out.
I'm sorry, Shakira, come on.
Okay, and I assessed the 19 spots. 18 spots. We'll be done with that. I think really assess it, but whatever. I'm done. Move. Alright, next I'll just be assessing your abdomen. If I can have you lay back down. I have to flip your shirt so I can look at it. Okay. Alright. Looks good. So what I'm going to do is Auscultate. I'm going to start in the right lower quadrant.
I'm ticklish, I'm sorry.
Active bowel sounds in all 4 quadrants.
You heard?
I still have to. You lift up your shirt again?
Sure.
So now I'm gonna percuss. So I'll be lightly touching it.
Okay. I'm sorry. Go ahead. Here, I'll just put my hands underneath me.
Okay. Now I'm gonna lightly palpate it.
Hold on. Okay.
Now a deep palpation. Alright. Your abdomen is clear. You could just still keep laying down. I'm gonna assess the lower part of your body. Okay, I'm checking your legs for even symmetry. Your hair is dispersed good throughout. I'm gonna assess this posterior tibialis pulse right here.
Come on, girl.
2 plus. What's wrong with it?
I think maybe it's just when you touch me like this. Like, touch me like that. Go like this.
Okay.
Go like pulse. Yes, firm. That's why it's not ticklish. When you sneak up, it's ticklish.
Then I'll do this dorsal. I'm doing it like that, and you're still doing all those other stuff. So it actually doesn't matter how I'm touching you.
Okay.
I'll do the dorsal pedis.
Okay.
Okay, it's a 2+. I'll assess your capillary refill for your feet too. On this side. And if you can just push down and then pull back, then you'll just push your legs up. Push the leg up. Okay. And that'll complete my assessment for today. Did you have any questions or concerns?
No, thank you so much for your time.
Thanks.